Right. Folks are still joining, but I can start to introduce you so that as for the folks that are here, we're up to 80 attendees. So I think the last maybe 20 or so will continue to trickle in. Um, I'm not sure if we shared in week one that this group started with 17 people in a conference room. So it's really amazing for us to have this level of attendance. So thank you all for being here. I'm thrilled to introduce Dr. Dennis Lee as the speaker today. He's actually one of the original creators of the reading course and has been around with Miriam Rafferty, who will be speaking next week since the beginning. And he has graciously offered to speak with us today about theories, models, and frameworks. Oh my. And Dennis is core faculty both at the Center for Dissemination and Implementation Science and the Institute for Sexual and Gender Minority Health and Wellbeing. And he is an expert in all things theories, models, and frameworks. So I'm going to turn it over to Dennis to get started.
Thank you so much, Sarah. Really happy to be here and talk to you about one of my favorite nerdy topics, which is theories, models, and frameworks. Oh my. And if you haven't clocked the reference, I'm a big fan of The Wizard of Oz and of course now Wicked as well. So you'll see a bunch of those bits and pieces of that Americana popping up throughout the presentation. But today I'm going to start by helping you all make sense of IS theories, models, and frameworks. We'll kind of go through some popular ones, talk a little bit about how you select theories, models, and frameworks for your work, putting them all together because there's a lot of concepts to get organized. And then we'll have our usual breakout groups and rich discussion. I'll say that these slides do have a lot of information in them. I might not get to everything. I will point out where there's more information I've put in for your reference later on as you need it, but I'll hit all the highlights and kind of all of the important things you need to know. The learning objectives for this week are to define and communicate D&I research terminology and describe a range of D&I strategies, models, and frameworks, identify appropriate conceptual models, frameworks, and program logic for D&I change. So Sarah and Corey shared last week this scary statistic, and it takes about 17 years to turn 14% of research to the benefit of patients. Now I'm going to share one more scary statistic for you. There are currently over 143 documented published D&I theories, models, and frameworks in the literature. And that number alone can be incredibly jarring for folks who are, especially those who are just starting out in implementation science. Like, where do you even begin with that? That's an overwhelming amount. And so we are here today to help you make sense of that and to tell you that it will be okay. It is not as scary as it may seem at first. And I'll do this primarily in 4 tips to make TMFs more accessible for you all. The first one is that the distinction between theories, models, and frameworks is really not important at this stage where you are right now in your implementation science learning. Which is why we often typically group theories, models, and frameworks, or you'll hear TMFs or MTFs, because for most implementation researchers, especially those kind of starting out in the field, kind of understanding the nuances of the differences between them is not so important. I have provided some formal definitions for your reference here that you can look at kind of at your leisure later on. But really the loose distinctions among these 4 things, and I've added taxonomy as well, because you'll hear that from time to time, is around 2 axes. Is something predictive or is it descriptive? That's the one axis. And the other one is, does it talk about the relationships between things, or is it about classifying things? And those 2 axes kind of separate a theory, model, a framework from a taxonomy. But across all of these categories, the application in most IS studies is very similar. These provide you lists of constructs to study and or measure. And I'll throw in a warning as well, like don't necessarily trust the name of a particular theory, model, framework, or taxonomy, because a lot of them use something in the name, but actually would be classified as something else. In public health, you might be familiar with the health belief model, but that's considered a theory, not a model. It's just an example. Our second tip is that all models are wrong, but some might be useful. And this tip is here to say that there will never be a perfect model for your work, and so don't fret so much about picking the right one, as long as you find it useful for your specific context and your purposes. And this focus on usefulness or utility is going to be a through line through the other tips. I believe Sarah and Corey presented this figure last week, or at our last session. And the question really is, why, if they're all wrong, why do we even use them at all? And the answer is that they make our lives simpler. Implementation science is, like all things in the real world, incredibly complex, as Sarah and Corey presented on last time. And using different theories, models, and frameworks help us wrap our heads around all of those complexities. They tell us kind of what the important things are to focus on, what things we might be able to let go of, help us categorize and describe things. And then importantly, they help ensure that we don't forget key pieces. We talked about implementation science being incredibly multi-level, and so it's very hard to keep track of all of those levels, and theories, models, and frameworks can help us do that by guiding research questions, variable selection and measurement, data interpretation, and so on. So in what ways can theories, models, and frameworks be used then? How are they useful? And here's why the Nielsen article that was assigned to y'all is so seminal. It really shifted the way that implementation scientists started conceptualizing our field and different parts of our field in our work. You may recognize this figure from your reading. There's three major goals of these implementation science theories, models, and frameworks, and the five main types, which I'll go kind of quickly over really now. The first type were the process models. And these are the steps that you take, or what I think of the how-tos. These types of process models tell you what to do in order to implement something. They specify the steps, the stages, or the phases in the process of translating research into practice. The aim of process models is to describe and or guide the process of translating research into practice. So again, they tell you what to do. We will touch on this throughout the reading course, but there'll be a deeper dive on process models in week 9. One of the most popular process models that you'll find in the literature is called the EPIS model, or exploration, preparation, implementation, and sustainment. And the model, as you see depicted here, basically says there's 4 phases: exploration, preparation, implementation, sustainment. And each one is kind of, the end of each phase is earmarked by a particular a turning point, like an adoption decision, or where training and coaching begins. So if you are starting a new implementation project, you might follow EPIS and start with exploration and move into preparation before you actually get to full implementation. The next grouping of theories, models, and frameworks in the Nielsen article were determinants frameworks. These specify the barriers and facilitators that affect the likelihood of success, or as they said, they are barriers and enablers that influence the implementation outcomes. So these are essentially lists of constructs to consider as predictors or moderators of implementation in your analyses, and to address with strategies, which we'll touch on in a second. We will be doing a deeper dive of determinant frameworks in week 4 of the reading course. Probably the most popular of the determinants frameworks is called the CFR, or the Consolidated Framework for Implementation Research. And as you can see depicted here, you have the multiple levels and lots of constructs in each level, consolidated from across a number of implementation, from a big literature review that the developers did. And they basically said that at each of these levels, here are some of the most important things that you need to consider that might affect implementation. It does not describe any of the relationships or the interactions among these constructs, only that they exist at these levels so far, or as probably it's been used in more than 400 studies at this point. I think that number was from last year, but you can see it's a fairly comprehensive checklist as you use it to look through what might or might not affect an implementation. Another popular determinants framework that's been gaining a lot of use recently is the health equity implementation framework. You'll see it has a very similar circular structure. A lot of the determinants frameworks like to use a circular picture. This one is specifically focused on healthcare settings and explains factors underlying kind of differences in healthcare for vulnerable populations. And it's built off of another determinants framework called IPARS. With the focus specifically on like the clinical encounter dimension and health equity in each of the domains. There's a lot of similarities and overlap with the CFIR, and we'll touch on that in a bit as well. I'm going to breeze through classic and implementation theories for time, but you can read a little bit more about the examples in the slides when you get them. Theories, as I mentioned in that first overview slide, focus more on the predictive relationships across constructs. And so they're a bit more focused than determinant frameworks. Determinant frameworks tend to be a bit more comprehensive. But essentially, the difference between classic theories and implementation theories is that classic theories originate from outside the field of implementation science, and implementation theories originate from inside the field of implementation science. A big example of a classic theory is Roger's diffusion of innovation, where Roger theorized that these factors of relative advantage, compatibility, complexity, trialability, observability predict adoption. And you'll see these when we go back to CFIR, you'll see these things show up in the consolidated framework for implementation research. Again, implementation theories are just theories that were developed inside implementation science to help implementation research understand how constructs relate to each other. And a popular one or example is like the organizational readiness to change by Weiner. The final grouping that Nielsen talks about was called evaluation frameworks. These are used for organizing and specifying the study outcomes. What do you need to measure at the end of your study in order to determine whether or not it was successful? And again, this is mostly used as a list. It's a list of constructs that you want to measure as outcomes in your study. And we'll do a deeper dive into evaluation frameworks and outcomes in week 6 of the reading course. A popular implementation outcomes model is called the implementation outcomes model, and by Proctor, and it talks about, or they talk about 8 implementation outcomes of acceptability, adoption, appropriateness, cost, feasibility, fidelity, penetration, sustainability, and how those relate to our quality or service outcomes and the downstream client outcomes that you want to see in the patient or client populations that you're working with. Now, in addition to all of the theories, models, and frameworks categories that Nielsen put forth, we also have our little taxonomies. And primarily they fall into 2 categories. We have taxonomies for the interventions or the things that you're trying to implement. Taxonomies are just descriptive lists. They're not intended to predict a phenomenon at all. So on the left, you'll see a taxonomy that might help you understand kind of what you're trying to implement. This one is called the 7 Ps, and your thing or your intervention might come in the form of a pill, a program, a practice, a principle, a product, a policy, or a procedure. And it's, again, just a way to help organize your thinking around what is the thing that you're trying to implement. On the right-hand side, I'll mention that we've added a new session this year based on past participant feedback in the reading course. And so our next session in week 3 is going to focus on selecting and adapting the right thing for your setting. On the right-hand side, you'll see a popular taxonomy for strategies. Strategies are the actions That again, they're the actions that we as researchers or implementers take to ensure that others do the thing well. We'll talk more about strategies in week 4. So I know I went through that very quickly. You might be ready for a nap, even though it is only 11 o'clock in the morning. Um, so we'll move you on to tip number 3. There's really no, the only bad choice of a theory model framework or taxonomy is one that is used for the wrong purpose. As Nielsen pointed out in his article, different TMFTs focus on different aspects of implementation. And there's a lot of variation among theories, models, and frameworks that serve the same purpose, but more or less, ones of the same type, meaning like all determinant frameworks or all evaluation frameworks or all process models. Um, there's a lot of overlap among all of the ones in the same kind of category. And if you find one that works well for your needs and you can justify or defend its specific use, then go with it. There's really like, again, all models are wrong, but some of them are useful, so pick the ones that are useful to you. I'm going to speak a little bit briefly about selecting TMFs. One of your supplementary readings talked about this. The Birkin article was did a survey of folks around how they went about selecting theories, models, and frameworks to use in their projects. And the big takeaway that's highlighted in the purple is that there's no one way to select theories, models, or frameworks. But they did say here are some criteria to consider in your choices, including empirical support behind that theory, model, or framework, the analytic level, is it at an individual, organizational, societal level, application to a specific setting or population, explanatory power or testability if you're really trying to study kind of the relationships between constructs, description of the change process, and then other process guidance. So again, it comes down, I think, to justifiability and usefulness to you and your project. There's a really wonderful resource online called the disseminationimplementation.org, where you can actually browse all of the theories, models, and frameworks that are in the literature and kind of sort by what you want to use them for. So I highly encourage you as you go through your implementation science journey to play around on that website and see kind of all of the cool things that are out there for you to select from. And finally, for tip number 4, as Nielsen pointed out in his article again, different TMFTs focus on different aspects of implementation. So you usually need to use multiple TMFs in a single project. And in fact, reviewers of implementation science grants will often expect to see multiple theories, models, and frameworks, and a justification for the distinct purpose of each one. And if you only say you're using one, that's usually a ding against you, depending on the type of grant you're proposing. So you have to use lots of theories, models, and frameworks for one particular project, and we have lots of them to go through. And I know I just went through a ton of different classifications of these theories, models, and frameworks. So how do we go about making sense of all of it? First, we have our 7 Ps. That's the thing we're trying to implement. We have our determinants frameworks. These are lists of constructs that might influence the success of implementation. We have our taxonomies of strategies that tell us, how do we help people implement the thing? We have our process of like telling us how we should go about using strategies to implement the thing. And we have our evaluation frameworks that tell us what we need to measure at the end. That's a lot to consider for any one project. But if we put them all together, we end up with the implementation research logic model, which is another of your readings that you had this week. I want to emphasize that this is not a new theory, model, or framework. This is a theoretical model. This is a trans model that just, it's a way of organizing multiple theories, models, and frameworks together. And the reason we're introducing it is because it really helps organize all of the multiple components of an implementation study. It also helps specify any of the hypothesized relationships among key constructs. So between the different boxes of the logic model between determinants, frameworks, and your outcomes. What are those relationships? The IRLM is a flexible, pragmatic, and highly modifiable tool for a range of different approaches. If you read through the article, I believe the supplementary material had lots of different um, examples of how you could tweak the IRLM to fit a specific study type or specific context. It ensures that we use an evidence-informed process to guide the implementation, so it can build process into it. And then it was developed here at Northwestern and really demonstrates our longstanding kind of reputation and for pragmatic implementation. So we're very proud of it. It's also, I'll also mention it has become increasingly required pieces of certain RFAs that are implementation focused. So the IRLM is, again, a way for you all to fill out or use different theories, models, and frameworks and put them all together. So you see the innovation. We have the 7 Ps at the bottom. We have barriers, CFIR over on the right-hand side. There's another depiction of the ERIC strategies taxonomy up top, and then outcomes over here. For time, I'm gonna show you briefly how we fill one of these things out. So how do we go about building a simplified IRLM? And I'm going to use a semi-historic example. Some of you may be familiar with Ignaz Semmelweis's story. He was a Hungarian doctor who is considered the father of hand washing before medical exams. So he had noticed that there was twice the maternal mortality rate in doctors' wards versus midwives' wards. So mothers who were being seen by doctors were dying at twice the rate of mothers who were being seen by midwives. And fast forward, he hypothesized that it was hand washing, found that it was hand washing that was, or the lack of hand washing that was causing the higher deaths. And so he wanted to implement hand washing in his medical setting. So the thing that we want to put into place is hand washing before gynecological exams under the 7 Ps taxonomy. That might be considered a practice. How do we know that the practice worked? We will use our normal, we'll select a health outcome that will help us understand if hand washing was effective. So a decrease in maternal mortality, specifically from streptococcal infection. What might get in the way of doctors washing their hands before gynecological exams? So these would be barriers, and we use a determinist framework to kind of level these out. At the individual level, doctors might believe that they're invulnerable to disease or invulnerable to transmitting disease. There might be a lack of knowledge. At the innovation level, at that time, there was limited evidence about hand washing effectiveness. Determinants frameworks will also tell us what might be helpful. So at the inner setting, the mortality rate might actually make hospitals look bad. And so hospital leaders might be very encouraged to want to push forward something that would reduce those rates. In the strategies bucket, this tells us how we might address the barriers and facilitators. So we might use education and training, or Semmelweis used education and training. And also hospital mandates. The leaders of the hospitals might say, you must do this. And of course, how do we know that these strategies worked to increase implementation? So we would measure adoption or the percent of doctors who wash their hands before the exam. Hopefully that went up. And then we might measure fidelity, how thoroughly doctors wash their hands as to track kind of the implementation process. I'm going to end with a case example that we are going to use for the rest of the course. And we are going to be focusing and building an IRLM out for this case example through the next couple of weeks. So we're focused on screening and brief intervention for risky drinking. This is, I believe, a study of Sarah's. The setting was 10 pediatric trauma centers in 10 different health systems. So they first identified the gap. Level 1 pediatric trauma centers have a mandate to provide screening and brief intervention for risky drinking, but current rates were low of SBI. So there was also screening based on clinical judgment is often racially biased. So they selected their thing, or identified the thing, which was screening and brief intervention using a protocol recommended by national organizations. They assessed barriers and facilitators, so reviewing the literature on the barriers to screening and brief intervention. They also surveyed 10 system partners to identify more barriers and facilitators. And then in this project, they created a blueprint using the implementation research logic model to specify barriers and facilitators, then the implementation strategies, and how they're going to measure the success of that implementation through implementation outcomes. To kick us off on this, here we have our trusty IRLM again. And here the innovation will be screening and brief intervention. As I mentioned, we're going to be spending more time on this in the next 3 sessions, and specifically the thing will be the next session. So we'll revisit this and we'll come back to it when it's fully completed as well. And then how do we know that this screening and brief intervention might work? Well, the primary outcome for the study was patient follow-up with primary care, and secondary outcome was reduced drinking. And then over the next couple of weeks, we will be filling out the rest of the boxes. All right, we made it with a couple minutes to spare. Thank you for sitting through that journey with me. Some final thoughts and discussions, or before our discussion, is that theory, models, and frameworks can be scary at first, particularly for new learners, but hopefully the 4 tips that we presented here today can make them a little bit more approachable to you. In fact, the theories, models, and frameworks are so scary that I went as the Nielsen framework for Halloween last year. And Pierre Nielsen actually emailed me about this photo, which was kind of like meeting your heroes, which is very cool. So in your discussion groups, talk about how might you use theories, models, and frameworks in your existing work. What types seem like the best fit for where you're currently at? What concerns, if any, do you have about using theories, models, and frameworks in your work? And what could help alleviate those concerns? What theories, models, and frameworks have you encountered before? And how useful or not useful were they? And with that, I'll let you all go on to the discussion groups, and we will see you next time on February 19th for session 3.
That was an incredible amount of great information in 30 minutes. Dennis, there's a lot of love for you in the chat. I also want to note that Dennis's incredibly epic Halloween costume was seen by the lead author of the article you read because his son saw it on social media. And so he actually wrote Dennis a very formal email like, I loved your Halloween costume. Like, it was really wonderful to see. So it was great to see, dissemination in another way. We're going to start the process of assigning folks to groups. That should happen quickly. And we did see a lot of people join though with like phone numbers and iPhones, which we can't usually manually assign to groups. So let's see how the assigning process goes. And if you're not readily assigned, we'll work with you to get you to a group.